Time being, we can speak to our health correspondent Lauren Moss, who's here with me. And Lauren, just a few minutes ago, we got the new UK figures and the new England figures for cases and for deaths. Just run us through those.
Well, in England, like you mentioned there, the latest figures of the number of people who've died in the last 24 hours have been released. 367 in England, but UK-wide, a total of 393 more deaths across the UK in the last 24 hours, which now takes the total number to 1,801 people who've tested positive for coronavirus and died in hospital. Now, this is the largest increase we've seen, but over the last few days, there was an increase, although the number of deaths was still rising, but not as a rapid rate as they might have done. There were 260 deaths on Saturday, 209 on Sunday, 180 yesterday. Now, this time last weekend, there was also a slight dip in the recorded number of deaths. So this increase of over 390 today isn't unexpected, although it is still concerning and will be very concerning to some. It isn't rising at an increased rapid rate as some had feared, but that total number of UK deaths now stands at 1,801.
So this is what we've got to get our heads round, that the numbers are going to go up because there's a time lag between contracting the virus and then really showing the symptoms. And we have been told, haven't we, that people mustn't despair that the social distancing measures aren't working, because they probably are.
Absolutely. I mean, it's still too soon to say about those social distancing measures. I mean, we're sort of the second week into the most stringent social distancing measures announced last week, sort of staying home, only going out when absolutely essential. And the people who have passed away in the last few days and are critically ill now are likely to be those who contracted COVID-19 before those most stringent social distancing measures were introduced. And yesterday, the Chief Science Officer, Sir Patrick Vallance, said although hospital admissions are continuing to rise, they're rising at the same sort of rate every day, not at an increasing rate, although they are increasing, if that makes sense. So we are expected to see that, and it will be a couple of weeks before those social distancing measures that were introduced last week and the week before will likely have an impact on those hospital admissions and the number of people that are losing their lives.
And just on the issue that continues to really concern medics about the lack of personal protective equipment, what are you hearing? Does that still continue to be a real issue?
This is varying across the country. I speak to some medics. I spoke to some medical students working at Oxford's John Radcliffe Hospital yesterday, and they told me that they haven't had an issue with PPE, that they're seeing it's coming through. But then you speak to other doctors and you hear from the head of the British Medical Association, who says, there is a real issue, and some medical staff have been resorted to try and buy their own on the internet and going to shops. So I think although more is getting out, the masks, the gloves, the goggles, the aprons, that sort of thing, it still needs to get through, and faster, probably much like the testing that we keep hearing about. We should get an update, by the way, on those testing figures later on this afternoon.
Great. We'll hear from you again. Many thanks. Lauren Moss, our health correspondent there.